Hi, my name is Hunter, and today I will be performing the skill Ostomy Care, and I'm wearing school-appropriate scrubs. I have my badge, and then my supplies. So for this skill, we will need our patient, our plate, our stoma, ostomy bag, an appropriate disposable trash bin, clean gloves, 2 towels, and then our measurement tool for measuring the size of the stoma for appropriate placement of the plate to secure the ostomy bag. Okay, so for this skill, I would knock on the patient's door, enter the patient's room, perform my hand hygiene, introduce myself to the patient. Hi, Mrs. Smith. My name is Hunter, and I have been asked to perform ostomy care. Can I get your first and last name and your date of birth while verifying it with their armband? Okay, that's correct. Patient has been verified. The next step we would want to do is explain the procedure to the patient. Okay, Mrs. Smith, we're going to go ahead and change out your ostomy bag. We'll go ahead and remove it, and then we will take off the plate to your ostomy, and we'll also inspect, cleanse that area, make sure you're comfortable, and get you repositioned in the appropriate position, and make sure she's comfortable. Okay, so we'll go ahead and get started. So I would make sure that the patient is in the appropriate position. To do this, whether we have them sitting up. Okay, so go ahead and apply our clean gloves. So I'm going to go ahead and remove that bag, okay? Right. Okay. Okay. Away from that. Okay. And then after removing the bag, I would then go to this would be sealed ideally in the real setting. And then after I have the bag, I would then go to the designated area to dispose. And when we are disposing, if it was liquid content, we would pull a measurement on it. And then we would also want to inspect the stool, whether, inspect it for odor, color, type, consistency, all of those parameters. And then we would dispose of it after we pulled the measurement and empty the contents. We would dispose of it, and then after that would return back with the patient. But since I only have one, I'm going to just reset it over here. Okay, all right. Now I'm going to go ahead and remove the plate, and we would do the same method as if we were doing similar to removing a bandage. So we would start with the edges and then pulling away from the stoma, okay, and then disposing of it. But again, I was only sent one, so we're going to go ahead and put it back over here. Okay. All right, and then next we are going to go ahead and clean and inspect the area. All right, Mrs. Smith, I'm going to go ahead and get that cleaned up for you. And when we are, cleaning the stoma, we want to use warm water in the appropriate solution that the provider has prescribed, right? So we'll go ahead and get that cleaned up. Okay. All right, and then we dispose of it. Okay. And then we would want to inspect the stoma, make sure that we don't see any abnormalities. There's no skin breakdown, skin irritation. And ideally the stoma should be a beefy red color. And then if we were to see any purple, gray, signs of necrosis, we would certainly want to let the provider know, immediately. Okay. All right, Mrs. Smith, your stoma and everything looks great. So we'll go ahead and we'll get that dried up. Make sure that it's dry before we go ahead and place the new plate. So in the next step, we would then want to measure our stoma, and this has been pre-measured already, and this has been pre-cut. But in a real setting, we would measure the stoma. Okay, all right, and we are measuring at 1 3/4. All right, and then we would take the measuring tool and we would draw out the appropriate sizing, and then we would cut the plate for the appropriate size of the stoma. Okay, all right, so then we will go ahead and dry that area up before applying the barrier cream and then placing the plate. We want to make sure that the area is completely dry before we place the new plate in the ostomy bag, as moisture and it being having condensate and moisture would only be it would put them at a greater risk for skin breakdown, right? So we'll go ahead and dry that up. Okay, and then dispose in the trash bin, and then we would go ahead and apply the barrier cream or paste. Right. Okay. All right, we're gonna go ahead and place the plate. Are you doing okay, Miss Smith? All right, we're gonna go ahead and put a new plate and ostomy bag on you now, okay? All right. So in a real setting, I would remove the backing and then place it, right? Okay, make sure that it's completely sealed, as we want to ensure that, you know, it's completely sealed. There's a good adhesion to avoid any, you know, leakage, which could lead to skin breakdown. Okay, so after that, we would go ahead and place the ostomy bag, which will just clip on. Okay. And we want to make sure it clicks all the way around. Okay, and then if the patient was able to, we would then have them place their hand over the stoma, as that heat is going to help secure and adhere the adhesion, we would have them place their hand over it to help with that adhesion stick to make sure that it's sealed appropriately. And we would want to do it for the appropriate amount of time. So after that, we will go ahead and remove the air in the bag, and then we would secure it with a clamp or securement device. Like so. All right, Mrs. Smith, is that okay for you? Does that feel okay? All right, and then we would make sure that the patient is comfortable and they didn't have any questions or concerns. And then from there, we would go ahead and remove our gloves. Dispose in the trash bin, perform our hand hygiene. Okay, and then we would leave the patient's room, and then we would document the procedure that was performed.